Welcome back to Rohrich Knows Best. Let's talk about PDGF, a very hot and controversial topic. I'm going to tell you some myths and some truths about it. So, what is PDGF? And why is it so controversial today? It's a key regulator of cell growth and tissue repair. And it plays a critical role in life, fibroblast activation, angiogenesis, and collagen genesis. And it's been used in regenerative medicine and also in reconstructive medicine for quite some time. In fact, there are 4 FDA indications for it. But its emerging use in regenerative and aesthetic surgery is what's making it controversial. So the advent of recombinant PDGF therapeutically is really amazing. It's got 4 FDA indications, for wound healing, maxillary surgery, orthopedics and spine regeneration. All of these have been approved as well. And now it's emerging into post-procedural skin rejuvenation. And it's registered with the FDA, but certainly not approved. So it's an off-label use. So the 4 indications, including the 2 in orthopedic surgery, are very powerful. And it's really been, has got over 1,000 publications, over 150 patents on its use, and over 5 million patients have been treated. So, so how does it differ from PRP, platelet-rich plasma, or platelet-rich fibrin? Okay, first of all, it's pure, it's proven, and it's really potent. It's significantly more potent than any of these products. And it's quick to use. It's off the shelf. It's endotoxin free and it's sterile. And so it is completely different. There's no special equipment needed. It's ready to use. There's no blood draw. And it's got an amazing high concentration of growth factors in it, specifically PDGF, which is the most powerful growth factor. The other thing is, people say, oh, it's just another type of exosome. The answer to that is absolutely not. Exosomes are extracellular vesicles that are messengers. They carry things, like grocery bags. They carry things. But the exosomes carry things that may or may not be helpful. And these PDGF actually is very specific. It is a growth factor only, nothing else. And I think that's the difference. PDGF is an active protein, and it's got 4 FDA approvals. It's sterile, it's endotoxin free. So it's really been proven a long, long, long time. So how do I use it in my office? Obviously, as a plastic surgeon, it comes in an off-the-shelf manner in sterile vials. And basically, I use it for tear trough, fat grafting, blending dilated cheek junction. I use it in all my facelift flaps. I spray it in. Am I doing a deep plane or smash facelift? I'm doing that for over a year. And I use it for laser resurfacing, especially laser coring, because it really enhances rejuvenation and actually enhances recovery and also minimizes pain control. And so in the tear trough, I've used it now for almost 6 months in multiple patients, because I don't use fillers in the tear trough anymore because of all of the issues associated with that. But really, I'm blending it. And the key with the use of PDGF in this off-label use is the fact that it's got to be blended, and I blend it and dilute it in 6 cc's of sterile saline with a half cc of lidocaine, and this is all keeps it activated. And the key is stay deep with it. That's really important to do. Stay deep, and I blend it, and I use it with fat grafting and facial augmentation, in blepharoplasties. I've used it in multiple patients with that. I've used it in fat grafting for the eyes and also in the face, as I mentioned it. And in facial rejuvenation, I blend it, and I blend this 20 cc's with 1/4 cc's of PDGF, and I'll put in 10 cc's in each side, and it's amazing how it minimizes bruising and swelling in these areas. So, and these are just some examples of facelifts. And then in laser microcoring, especially microcoring, I will use it at the end of the procedure where I'll mix it up. And this is the one time it comes with some uncross-linked hyaluronic acid And basically, you can do that in a droplet form, and you can apply it topically. And it's been done not only for lasers, but it's also done for microneedling and anytime you've got exposure of the superficial portion of the skin. Then I give them the rest of the product to go home to apply every 6 hours. And it amazingly helps to seep into the deep pores, especially with laser resurfacing, to give you enhanced regrowth and rejuvenation, and it minimizes bruising, swelling, and redness. And these are just some examples where it's been used with laser microcoring in these types of areas. And there's been also, and these are my patients that I've done it on with lasers, facelifts as well, in eyelid, blending of the eyelid cheek junction along with facelifts spanning. And then these are examples that were done to show how it improved the result of downtime. This is like 1 hour after doing a microneedling. It's amazing how it's actually decreased the redness in this area, enhancing collagenesis in this area. Here's another patient with skin pin. Again, this is an example with a skin pin with pure PDGF. And so there's another example of how you apply it immediately and it decreases post-inflammatory redness. But the real crux has been in aesthetics, and there's been some critics on social media that talk about, oh, it's misused or you shouldn't be using it all. I think the science of PDGF is far better than most of the products that are actually used by practitioners today. So is it a miracle molecule or is it a misplaced panic? I think the biggest thing you have to know is that it's a locally acting wound healing growth factor. It acts immediately and it binds to the receptors and it drives fibroblast and extracellular matrix activity. But it's cleared quickly. It's not a permanent on switch. So the cancer concerns about chronic internal signaling is not at all true. It's totally untrue. And it's got the 4 FDA-approved uses in diabetic foot ulcers and periodontal bone regeneration, and then 2 in bone grafting, as well as injectables in the orthopedic surgery literature. And the black box warning was removed largely after safety studies, and that was done, and it was actually removed several years ago. So again, the kinetics are that it's rapid local clearance. The plasma is like half-life is in minutes. Systemic exposure is almost non-detectable. And medical dosing is really far higher than it is for aesthetics. So that's the other key. And the safety is that it's non-carcinogenic, non-immunogenic, and there really are no cancer signaling across FDA trials that have been shown. So antibodies are rare, low titer, transient, no clinical consequence. This is all in the science of PDGF. So please don't listen to the harbingers that are just spitting really non-truths, myths, that growth factors cause cancer. Fact is, it's dose and durations that matter, and that it's topical to the face, systemic flooding. Absolutely not. There's not hardly any systemic exposure, and it's rapid. And the antibiotic dangers is clinically irrelevant. So aesthetic applications, as I mentioned, in the face and the tear trough, and I think in so many other areas, I use it in my lasers as well. It's unbelievable. So you do have some ethical guide rails. You've got the FDA grade use. It's purified. It's short course. It's local, disciplined, low dosing, and of course you should avoid it in patients with pregnancy, cancer, or in unproven combinations. So really, the provocative questions are: if it's unsafe, why did the FDA remove the black box warning? And also, critics, they ignore the dose, the route, and the duration. So we shouldn't be fear-mongering. We should be following the science. So its role in facelift surgery is, I think, been unparalleled. The bruising and swelling. I used to use PRP and PRF for this, and now I've been using this for almost a year, and it's been truly transformative. And it's no more blood draws. It's off the shelf. and also the same thing with tear-trough and blending the ida-tree junction. So I think the take-home messages are it's safe, it's been proven, and it has 4 FDA uses. And of course, you have to talk to the patient about its use, that it's an off-label use, but it's been very much scientifically shown to be safe, and it has a local effect, and it's a rapid sequence use, and it works. That's the bottom line. And studies are forthcoming, certainly not only from my practice, but from so many others that really look at the science and not the fear-mongering that takes place all the time in the cosmetic surgery arena. So please give me your thoughts, give me your feedback on how you use it in your practice or why you don't use it, and I'm happy to talk to you and bring you on Rohrich Knows Best podcast to debate me on this and so many other new and innovative aspects of cosmetic surgery.